Umang,
Anji sir.
please introduce yourself in very brief.
Sir, my name is Umang, and I have done my schooling from Jain Bharati Megawati Vidyalaya. After that, I have done my graduation in Bachelor of Physiotherapy from Delhi Institute of Pharmaceutical Research and Science University. I have recently ended up with my internship from GB Pant Hospital, New Delhi.
So next, anything else?
Yeah, sir. In school, apart from academics, I was an active participant in all the co-curricular activities, and there was a summit known as Reaching a
So
Doctor.
let's not talk about the school. In what area are you active these days, apart from your job or internship?
Sir, if I talk on a personal front, I cultivated a hobby known as composing poetries, and I have did it before in my school days also, and recently I've composed it for numerous digital platforms on social media. And in college, from my college days only, I was involved in various camp organizations. It was part
So
of our
what is the type of your poetry? मतलब in what for what area you do write? Is it more of political or normal life events or motivating?
it at times it is motivating, at times it is life driven. Most of the time it is life driven, like there is no as such political touch to it.
Okay, so can you tell me any four line of your any poetry? Four lines.
So yes, I can tell. It is a Hindi poetry basically. Four lines. It is a short poetry I have written, and it was about me. सांवरी सी सूरत लिए. Sorry, sir, I'm not able to recall.
Any other?
Uh,
So you don't want to recite it, you just want to write it.
just have to tell it that way. Uh, for now, I can't recall, sir. Can you just get forward with the question? Later, I can answer.
Okay, okay, let's go ahead. So how did you decide to go for physiotherapy?
Sir, after my high school, I opted for biology, and when I appeared for PMTs, among at that point of time, what all options were available, I chose physiotherapy among the best available options,
So what
and
were the options? What
that
were
way I
the
just,
what were the
sir.
options with you?
Homeopathy, I got selected for, I cleared my entrance for homeopathy and Ayurveda as well. But at that point, I found physiotherapy more suitable, because
Suitable is in what sense?
sir, it was unconventional, and it was a growing field at that time, and no
So
medications.
is it still growing or you find it has become stagnant?
No,
Is
sir, there's a
physiotherapy
lot of growth in. Yeah, physiotherapy as a profession is still on a growing platform itself, and especially in India, if I talk about, it is growing and growing by leaps and bounds, and people are now becoming more aware about the therapeutic benefits of exercises. So
so
I don't find it stagnant.
do you find any use of physiotherapy or a physiotherapy professional these days in COVID era or related to corona disease or symptoms?
Uh, Yes, sir. There is a very important role a physiotherapist can play, and physiotherapists are working within the hospitals on that. If I talk about COVID specifically, there are three levels of the disease: primary, secondary, and tertiary. At primary level, we talk about the precautions so that we don't get infected by the virus. And at that point, we can introduce aerobic exercises in the regime apart from social distancing and doing other things. It will definitely add to the boost in immunity. And on secondary level
Aerobic
also the patient.
aerobic exercises boost immunity.
Yes, sir.
So what are those exercises? Can you tell anyone? So how
Sir,
come
aerobic
exercise can
exercises. Sorry, sir.
so how come exercise can build your immunity? Matlab, it's more of physical strength. So
Yes,
immunity
sir.
is based on mainly how your white blood cell is working or how antibody is being developed in your body. So how can exercise will improve your immunity?
Sir, that is the physiological aspect of building immunity which you are talking about. But exercise is indeed an important factor in immunity boosting. And basically, the kind of exercises I'm talking is aerobic exercises. It at first it improves the body strength, and it adds to the increase in lung capacity, which is an important factor in fighting COVID-19. And when the muscular power and the strengthening of the body and the stamina you have, it automatically adds to the body mechanism and the physiological changes within the body.
What you are telling me looks very promising. So that the aerobic exercise can improve the lung capacity and all the respiratory problem can be reduced due to these exercises. So why don't
Yes.
government and other people are exercising this practice or promoting this practice or promoting people to do those exercises at home?
Sir, what I feel specifically about physiotherapy, that it has not got that much of recognition till now, and especially in the country like India, where the population is very diverse.
You are a
People are
physiotherapy graduate. Why don't you do it at your scale? Have you tried telling people to go for aerobic exercises and this can improve if any time they can suffer with corona and related respiratory disease?
yes, sir. At my level, at individual level, if I say I have done it prior also, not in only in times of Corona, I have done it earlier also. I
So,
have
Matlab, these
told
days you
people
need to
about.
be more active about this. It is your profession. So how did you manage to tell people? You are telling one to one, or you are also writing a blog or anything? You are making videos for that.
Sir, I am till now I am just telling one to one. If someone comes, if
So
someone asks for it, or if someone.
don't you think it's very inefficient way to tell people? So let's say if I'll say you ki, speak 2 minutes about the benefits of aerobic exercise and just suggest one aerobic exercise to the people. So let's talk like we are creating a video. So what will you tell for the normal
So
people? So,
aerobic exercise. At very first, there is no as such one particular aerobic exercise. What exactly aerobic exercise is defined as the exercises which will add to the oxygen intake of within the body. So normal jumping, what we practice, can also act as an aerobic exercise, and it depends upon the personal capability or the personal body fitness of an individual. That from where that person will start, and as I have already said that it adds to the body strength and all. So we can what we can initially do, we can tell people in an innovative way that we can make some workstations. There is a term known as circuit training within physiotherapy, and in that what we do, we make three or four or five such workstations, and there we put some props, I would say, or some equipments with which people can practice exercises. So if I am doing it in a particularly rehab lab kind of a setup, I can put the dumbbells, I can put medicine ball, and I can put the weights and ask people to do them with number of repetitions. It depends upon the capacity of an individual and that condition of the individual. And if I am asking people to do it at home, and if they don't have that kind of setup, I can also use some home-based equipments that, as if like at the place of dumbbell, we can use bottles filled up with water, and we can do strengthening with them. And apart from that, the normal squats and jumping thing anyone can do at home. So these are the kind of aerobic exercises if we talk only about the exercise part. Now comes the relaxation part, that also adds to the lung capacity. And there we have breathing exercises, in which different types of breathing exercises are there. At first, the person can sit normally in any posture in a peaceful corner of the home, and can do deep breaths. Then it comes deep breathing with flexed knees. This is a specific position for those who are ill, those whose bodies doesn't support the normal
So,
breathing
okay,
patterns.
Umang, you seems to be a very professional in your particular field of physiotherapy, and I believe if you go with the same field, you can do wonder in that also. So, why do you want to change? Why are you not staying at your own field? Because you looks to be intelligent enough to pursue this field also.
Sir, it has numerous reasons, and initially I chose physiotherapy with utmost my clinical postings within hospitals. I found that everything in healthcare is nowadays more of medicalized, and people are not focusing on what exactly the condition has, what the condition is okay, but how any patient or any health seeker has arrived to that condition. Followed by that, when I did my rural camps, that was part of my curriculum, I realized that I can use this physiotherapeutic approaches to prevent so many conditions at primary level. All what is needed is just to socialize with every sector of the society, because people are not aware. So I feel that that is my personal choice, that I want to work for a diverse population, and I want to bring the best of this field into what I'm going to pursue.
Okay. So, tell me one thing that what do you see? Where do you see yourself in long term after 5 year or 10 year down the line?
Sir, better perspectives about this would be gained within the next 2 years. But if I tell about certain specific areas I really want to work upon when I become a public health professional, that too in social epidemiology, there are two areas. Number one, I would definitely like to address the mental health issues which are being generally neglected by most of the population. And number two, I want to talk about the menstruation practices within our country. People often talk about menstrual hygiene and the lack of sanitary napkins in rural population, but no one talks about one thing, and that one thing is that there are places where napkins availability of the napkin is not an issue, but the stigmas and the taboos related to it is a major issue. People don't wear it because of certain stigmas they have within their mind. So I really want to work within these two sectors within the next 5 to 10 years down the line.
Okay. So, can you describe the threat of COVID-19? Because government is removing lockdown day by day, and more people are now exposed to other people, and there may be a lot of people who are like corona positive. So what are the threats ahead in terms of health or corona situation?
Sir, as COVID-19 is one among the recent public health threats, I feel that unlocking things has to happen someday. And I have read several interviews of some experts, and people have talked about herd immunity in that. What I feel that the increasing number is definitely a concern for everybody, be it normal population or be it government. But the time government has taken by locking down, it has to. I think that they have done that. It has to be used for strengthening our healthcare systems, for strengthening not only the tertiary care hospitals but also the attention has to be paid to the primary care hospitals, so that even if we get infected, even if a larger population get infected, we should have sufficient treatment protocols. Because what is the good thing about this disease, the only good thing about this disease, that 80% of the cases are normally mild, and the cases those are severe are mostly because of the comorbidities that particular patient is having. So I think that it will be easy for the government to do if they will do it in a planned manner. And as I mentioned, that the need to strengthen the primary care centers is very very important for now, because as we have seen that what corona is normally teaching us is just to practice sanitation, to practice hand hygiene, that we are talking in the primary healthcare goals, but it has not been practiced in that manner, and I think that is why we are here. If it could have been done earlier, the condition could be better in this scenario.
Okay. So just tell me one thing. How we were, matlab, the way we were planning our health infrastructure or health policies and everything, and then after COVID, there must be a lot of change in our practices. So if I'll talk about the utility of physiotherapy ahead, so what would you suggest the government to do with the physiotherapy so that it can act as a necessary tool for further dealing with this kind of epidemic?
Sir, physiotherapy, number one, if someone would ask me about the suggestion, I will definitely say that mainstreaming physiotherapy by making a national council of that, so that the physiotherapists within the nation would be united together, and there would be certain protocols nationwide that they will follow, as we have in nursing council, as we have in pharma council. That is not there till in our country. And if I talk about the practice side, the chest physiotherapy is of immense importance at this point of time, because there are patients of pneumonia. Corona, uh, after a certain stage, leads to pneumonia, and for that we have techniques such as huffing, coughing, and percussion vibration that is of immense use at this point of time. So I think government will take some steps to curb physiotherapy, to curb COVID-19, as fighting a pandemic would be, and it should be, an intersectoral approach. No one particular field can do it by their own.
Okay. So tell me one more thing, Umar. Uh, why do you want to join only TISS? There could be other institutions who are also providing health administration. So what advantage do you get? Will you get at TISS?
Sir, what I found the best thing about TIS is that the population that goes there, the student, the kind of student that goes there for studies, is diverse, and I think it would first lead me, allow me to grow as an individual, because I will get the chance to be there with people from different cultural social backgrounds, and that will add to me as a person. And second thing, the kind of legacy this institute is offering since so many years in whatever course they are offering is one of the reason I would like to join this. And apart from that, the alumni base, and I'll not only say the famous or the eminent alumni. I think everybody from TISS, those who are within the college, are very helpful towards the students, those who are not even part of the college. And I think that these are the reasons that cumulatively add my interest personally towards this.
So one more question I'll ask you. Uh, how your profession or whatever the future profession you are taking is going to fit with your life goals or your personal life?
Sir, I think that what I am going to practice is social epidemiology, And social when we say that we have to look for the social factors that are causing diseases, it is itself a very diverse term. And if I have to align this with my personal life, I feel that the terms came much later, the course came much later to my mind. But the kind of person I have been since my school days only, it has somewhere turned me here. And when I think any individual is that is shaped in it that way, so it makes the thing or the job or the profession they practice easier for them. And one more thing I would like to add, uh, social epidemiology in public health offers the individual to practice both in rural and urban area. Though I've been brought up in New Delhi, but my school was not in within the main city. It was located in a little bit of periphery. So I have my friends from rural backgrounds also, and I have seen the rural background people, and I know that how certain things happen at that level. Apart from that, I will say that my roots lies in Uttar Pradesh. So not on a very regular basis, but I have visited villages in my vacations earlier. So I know basically what I want to convey from this point is that I know how people from different backgrounds pursue certain things, and specifically healthcare beliefs I have learned during my hospital visits, because all of my postings were in government hospitals. So I think that I have this individual quality, I would say, that I can socialize with both of them, and I can make them accept me as a person before getting into any protocol of improving healthcare.
So currently, where you are working or getting internship, so what is the work culture there? So, is physiotherapist or is any medical professional who is not directly from MBBS background or medicine background, how those professionals are being treated in those hospitals?
Uh, Sir, what I would, so can you please repeat the question?
My
Last part of
question
the
is
question.
the hospital where you are working. So, how is the motivation factor? How is the treatment of the people to the person who are not directly treating the people, those who are not doctors, those who are in the peripheral occupational therapy like nursing or physiotherapy and other professionals. So even lab technicians and everyone. So is there any difference between the way they deal with doctors and these people, or what is their work culture? I would
Uh,
like to ask.
Sir, from where I have done my internship, there is no such, fortunately, there is no such discrimination, especially if I talk on personal front. As a department within the physiotherapy department, our department was in neurology, and as I said that there is no discrimination. That means that we have our internal department work culture, that we have our own HOD over there, physiotherapy in charge. And apart from that, also the doctors within the neurology department and or the nurses are very cordial, and there is no as such discrimination within the hospital. But on a bigger picture, if I talk about, there are certain discriminations, be it taken from the pay scale or be it taken from the social respect. People there not discriminate, but generally, apart from that hospital, wherever I have been to several other hospitals as well. So it is a very individual view, I think, that how patients respond to certain people like physiotherapist or nurse. It is a very very personal thing for anybody. But yeah, in my hospital there was no such difference. Even the patients were very cooperative, and though there were times that whatever we used to suggest them, it was difficult for them to follow, but they tried their level best, and they gave us follow-ups as well. They visited on time, and they have shown they have said that there is an improvement within their health by physiotherapeutic exercises.
Okay, thank you very much. थोड़ा फीडबैक पे मैं बात करूँ कि तुम्हारा तो ऐसे बहुत अच्छा था, लार्जली यू आंसर्ड ओनली दोज थिंग्स दैट वाज बीइंग आस्क्ड टू यू, है ना।
थैंक यू सर।
तो जो सबसे ज़्यादा जो प्रॉब्लम क्रिएट करता है वो यही होता है इंटरव्यू में, कि आपसे जो पूछा गया वो नहीं आप बताते हो, आप गलत बोल रहे हो सही बोल रहे हो, दैट्स अ सब्जेक्टिव थिंग, है ना। बिकॉज आई कैन आस्क यू समथिंग एंड यू कैन टेल मी अ रॉन्ग फिगर और रॉन्ग एनालिसिस, दैट्स ओके, बट आई कैन नो कि हाँ मैंने ये पूछा तो मुझे ये बताया गया। दूसरा ये है कि आई वुड सजेस्ट अपार्ट फ्रॉम दिस इंटरव्यू पार्ट, तुम आज मुझे 2 मिनट का वीडियो तुम बना के भेजोगी अबाउट हाउ पीपल शुड एक्सरसाइज दीज डेज, क्योंकि मोर और लेस मुझे लगता है कि 10% पॉपुलेशन ऑफ इंडिया इज गोइंग टू गेट कोरोना, if what data suggests and what because the doubling rate is still high, है ना, still very less number of days, है ना। तो what I want that you people whosoever are there, जो आप जानते हो उसको बताओ लोगों को, आप 1 to 1 बोलोगे कितने लोगों को बोलोगे, है ना। सो क्रिएट अ वीडियो, 2 minutes वीडियो बाय सेइंग कि व्हाट दे शुड, एक पीपीटी भी बना लो तो बेटर होगा, है ना। वी कैन जस्ट पुट इट ऑन जूम पे रिकॉर्ड कर सकते हैं, पीपीटी बना लो, और दिस इज द एक्ट दैट यू कैन ऑलवेज क्लेम, नॉट चलो ठीक है कल इंटरव्यू है तो तुम बोलोगे कल ही हमने बनाया है तो इट विल बी वेरी वो, लेकिन अगर तुम ऐसा प्रैक्टिस की होती तो ये तुम्हारे में बहुत बड़ा ऐड करता, कि जैसे मान लो अगर कभी गलती से पूछ दे तुम्हें कि लॉकडाउन में तुमने क्या किया, तो तुम अगर ऐसा बोल देते कि लॉकडाउन में आई कीप ऑन केप्ट ऑन डूइंग दिस थिंग्स, आई केप्ट ऑन यूजिंग माय टाइम टू प्रमोट फिजियोथेरेपिकल एक्सरसाइज, बिकॉज आई थिंक कि जो आदमी कोविड से या कोरोना से वो होने वाला है, मतलब कोरोना होने वाला है, तो ही कैन डू दिस एक्सरसाइज टू इम्प्रूव हिज वो कि फर्टिलिटी कम होगी कोरोना की नेशन वाइड। तो ये तुम मुझे 2 मिनट का वीडियो आज बना के दोगी, ठीक है, क्योंकि यू नीड टू, एक एटीट्यूड तुम्हें डेवलप करना होगा कि जो तुम जानते हो उससे किसी का फायदा हो, है ना। तुमने अपना पोएम तो सबको सुनाया ना, भेजा अलग से भी कि ये भी पढ़ो ये भी पढ़ो, तो व्हाई नॉट दिस, है ना। दिस कैन हेल्प, अभी अभी तो इसी की प्रायोरिटी है ना, वी आर नॉट इन अ लीजर टाइम, है ना। तो ये तुम बना के दोगी, ठीक है।
ठीक है सर।
रेस्ट एवरीथिंग इज एनफ, कॉन्फिडेंट रहो। देखो यू कैन नॉट गाइड द इंटरव्यूअर की तुम मेरे से यही पूछो, है ना। हो सकता है तुमसे बहुत जेनरिक जेनरिक टर्म में पूछे, हो सकता है तुमसे बहुत टेक्निकल टेक्निकल टर्म में पूछे, बट एज लॉन्ग एज यू आर आंसरिंग इन द डायरेक्शन और इन द अलाइनमेंट ऑफ व्हाट दे आर आस्किंग, तब तक ठीक है, तुम्हारा इंटरव्यू अच्छा है, क्योंकि कहीं ना कहीं किसी ना किसी क्वेश्चन में यू विल स्टार्ट मेकिंग योर इम्पैक्ट, क्योंकि हर आदमी शुरुआत में अच्छा नहीं दिखता है, मेरी बात समझ रहे हो ना। मतलब कोई भी आदमी जैसे जैसे बैठते के साथ ना, देखो कोई भी आदमी बैठते के साथ इंटेलिजेंट नहीं दिखेगा, एंड एवरीबॉडी नोज कि लुक डजंट गिव यू मतलब एनी इंटेलिजेंस का, वो अगर देते भी है तो गलत है। तो अब तुमने बोलना शुरू किया तो मैं हर लाइन से जज नहीं करूंगा ना, तो आई गेट लॉट मेनी ऑफ डेटा फ्रॉम योर आंसर्स, मैं कुछ कुछ पूछता जाऊंगा तो वो एक बिल्ड करता जाएगा तुम्हारे लिए मेरा वो, कि हाँ ये इस पर्टिकुलर डायरेक्शन में यू कैन बी स्कोर दिस मच, एनालिटिक्स में यू कैन बी स्कोर दिस मच, है ना। प्रोफेशनल इनसाइट आपका बहुत है, ठीक है। तो इस तरीके से तुमको बोलते जाना है, तुम्हें कहीं पैनिक नहीं होना है, इवन इफ यू नो और इफ यू डोंट नो, ठीक है। नहीं जानती हो तुम बता सकते हो कि आई हैव नॉट रेड और आई हैव नॉट, मतलब आई कैन नॉट ड्राफ्ट इट राइट नाउ द आंसर, बट इस डायरेक्शन में आंसर हो सकता है, ठीक है। अब जैसे वो 2 मिनट वाला वीडियो भी था, तो उसमें तुम ऐसे बोल के बता सकते हो कि वी कैन डू इट इन मच बेटर वे इफ आई कैन प्लान द 2 मिनट लेक्चर, ठीक है। चलो गुड, बढ़िया।
सर
तो
ऐसा फंबल वंबल का तो नहीं था, मुझे ऐसा लग रहा
ना
था मैं
ना
बहुत
वो
तेज भाग रही हूँ, ऐसा कुछ नहीं था ना।
नहीं नहीं नहीं, ये सब बकवास, ये सब ये फीलिंग तुम लाते ही हो अपने लिए ना, क्योंकि तुम नहीं चाहते हो कि सेलेक्ट हो। तो
सर ऐसा
अगर
होता तो पढ़ते क्यों?
नहीं, ये मुझे लगता है कि तुम्हारा एक तरफ का आ, आ, एक तुम्हारा जो है एक दिमाग कहता है कि मेरा ना हो, इसीलिए ऐसा सोचता है।
सर एक दिमाग को लगता है कि नहीं होगा तो क्या
हाँ
होगा।
इसीलिए इसीलिए
हाँ,
नहीं, ये कोई बात नहीं, बात क्यों फॉर्मल करोगे।
मैं वो भेज दूंगी। और सर एक चीज और, मतलब जैसे अभी जैसे मैं ये पॉइंट में भूल गई थी, अब
हम्म।
पता नहीं वो आंसर देते हुए पता चला नहीं चला, पर एक दो पॉइंट आए जहाँ पे मैं पैनिक हो रही थी, तो इस
वो
तरीके से अगर कुछ
उसका
भूल।
कोई दिक्कत नहीं है, कोई भी नया, जैसे अब इंटरव्यू लेने वाला पैनिक हो सकता है तो देने वाला क्यों नहीं। है ना। अब मेरे पास कोई स्टेक है बताओ, मतलब एज अ प्रोफेसर, इवन मैं प्रोफेसर हूँ चाहे यहाँ तो मैं पढ़ा रहा हूँ, मेरे पास मेरा तो कोई स्टेक नहीं है ना वाइल टेकिंग योर रिव्यू। तो मैं जब पैनिक हो सकता हूँ तो तुम भी हो सकते हो। तो whosoever is on stage, whosoever is in front of audience can get panic। तो तुम भी हो गए तो कोई बड़ी बात नहीं है, तुम ऐसे भी बच्ची हो,